Good day to everyone, and welcome to today's webinar entitled The Power of Discovery, Aligning People and Processes to Support the Technology. I'm Mark Hagland, Editor-in-Chief of Healthcare Innovation. Today's program is sponsored by LeanTAS. Thanks so much to our friends at LeanTAS and to you and our audience for giving us your time and attention today. Before we get started, I have a few housekeeping details to share. To submit a question, please use the Q&A box to the left of your video window at any time. You do not need to wait until the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue to the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag #HILiveWebinar. Thank you. And at this time, it's my pleasure to introduce our speakers for today's program. Dr. Pallavi Sanyal-Dey is Director of Client Services for IQ for inpatient beds and is an internal medicine boarded physician who was Director of Clinical Operations for the Division of Hospital Medicine and a physician advisor for clinical documentation and integrity within the UCSF medical system at San Francisco General Hospital for the past few years. Dr. Sanyal-Dey is a practicing hospitalist at UCSF, where she maintains her visiting associate faculty position. And she joined LeanTAS in early 2020, where she partners with hospitals and health systems to successfully adopt IQ for inpatient beds for ideal optimal bed capacity management. Christian Jun is a product implementation specialist for IQ for inpatient beds, currently leading and supporting implementations with different health systems. Prior to joining LeanTAS, Christian worked in hospital administration and operations in an academic hospital setting. Based on his experience, he understands firsthand success starts with a supportive implementation team that partners with its clients to ensure long-term relationships and client satisfaction. He holds a master's degree in public health from Loma Linda University. Dr. Sanyal-Dey and Kristen, thank you so much for joining us today. And with that, the floor is yours.
Thank you so much for having us, Mark. Today, I think we're here today to learn about, I'll kind of set the stage with our objectives. Today, we're here to talk about anticipating and navigating challenges and roadblocks while integrating new technology, as well as addressing change management from both the people and process perspective when incorporating new technology into workflows. And really, we're here to help in understanding that there are multiple success factors in implementing a new technology, aside from just rolling out a technology.
All right, thank you, Christian. So let's move on to the material. So we're so excited to be here with you today. One thing we wanted to really highlight was getting a little bit into why sometimes certain projects, certain process improvement efforts, and even new tools, technology introduced to healthcare systems, why they fail. And it's important to highlight this because we will demonstrate through our presentation why we take the philosophy that we do at LeanTAS and specifically with IQ for inpatient beds. So some of the factors you see here listed in front of you are kind of the core things we've noticed over and over again, and I'm pretty sure they will be quite familiar for those who are working in the system as we speak. So the first point is just the mention of lack of planning. So one thing that has often been a challenge is for hospitals to just understand where are they right now? What is their baseline? And what are they trying to get towards? And establishing and understanding these things requires help from both data, IT, requires efforts from a lot of administrative and leadership staff to get all the numbers that you need to really define what's going on, and then to corroborate, do these numbers really paint the picture for what your baseline is at your hospital right now? Are they telling the story that matches the reality of your operations at this point? And then there's a need for folks to really come together from all aspects, different groups, different staff members across the hospital to come to an understanding of what is your true north? What are the outcomes that you really desire in your healthcare system so you understand the here, where you are, where you're going towards, and what is that gap in between. When these elements are missing, trying to introduce new efforts, projects, etc., it is hard to be successful with such endeavors, because not understanding where you are makes it that much harder to understand where you should go. Moving on to the other points, project dilution. So this is just rampant everywhere for obvious reasons. Everyone is stretched as far as resources go, especially when it comes to staffing, and then recently coming out of the pandemic and sort of the financial sort of status of every hospital and healthcare system, what they can and cannot afford to do. And because of that, of course, that has a huge impact on just burnout, period. And when you get that burnout, the idea that you can tackle chaos and even exertion in a strategic, smart fashion is really hard. It's very challenging. People are just tired. And to prioritize even what's going on in that realm when everyone's so stretched, it's honestly, everyone's just running around trying to put out fires. Now, the next point, inadequate vetting. This is actually a very key point, especially when it comes to introducing new tools and technology. The leadership really need to be engaged in not only understanding what are those desired outcomes and where we are right now, but the understanding of, okay, that means whatever project tool that I'm going to introduce is going to help us get to that desired outcome. And then as leaders, you have to help build that trust and alignment within your system. It is hard for third-party vendors or other partnerships to come in and introduce ideas successfully if the leadership is not on board, because staff members will only care about what folks within the system really have agreed upon and what they believe in, because they are all part of the same system. So just having that alignment internally, both from bottom up and top down, is extremely important. And that does require a lot of work prior to introducing such things. Moving on to reliance on technology. So, we are a SaaS software-based company, LeanTas is, and one thing that we definitely are very well aware of is you cannot just throw technology at systems or groups of people and expect solutions to occur thereafter. There are so many other pieces and parts and people that need to be involved to really make for a successful implementation of whatever it is that you are introducing. Technology itself does not solve the problem by itself. I mean, the greatest kind of example of that is just, having an EMR and by itself does not solve all the actual issues as far as processes go within healthcare systems. And then the last point is neglecting change management. So, change management is just a huge category in and of itself. And it is something that we all tackle with and deal with whenever you are working with people, especially in healthcare systems. And there's different types of staff members and trainees and providers and different roles. And when you have such a variety and breadth of work that is being done in a healthcare system to deliver care, it gets very complex. And people get tied to kind of the way they do things. And we've been great at creating workarounds when things get hard in healthcare systems. So to say that change management is necessary when introducing such concepts is an understatement. It is absolutely core and critical to any moment in time when you are doing or trying to improve something. And that does require a lot of training and education, and it requires just listening and observation. And that is something that we really like to do from the LeanTas IQ perspective. Let me pause there. I'm actually going to go on to the next slide. Christian, if you can kind of lead us into these three core pieces that are so relevant.
Of course. With organizational transformation, I think LeanTas, what Dr. Sonia Day had mentioned, is that we're not just a SaaS company. We come with a three-pronged approach, understanding that the people, process, and technology all have to work together in order to for an organizational to have success. The three things being people. We need to determine who should be involved early on and who are our most important assets in making the change. The processes and how the work is being done and how those processes can make work more efficient. Because changing around processes without a North Star is not as helpful to an organization. And more than anything, the technology, it enables the people to work more efficiently and makes their job easier, and especially within the hospitals, the need for leveraging technology and helping that to support the processes. In our implementation work and work with our customers, we recognize that all three parts have to work in conjunction with each other, and we spend a lot of time making sure all three areas are addressed. So one thing we like to say is that we are not just a consulting company. We don't just evaluate and give recommendations and leave. We build a partnership with our health systems and our customers that we work with.
Great. Thanks, Christian. We're going to head now into how we as IQ, especially for inpatient beds, how we have staged out a series of steps within implementation when we sign with a customer and get them started on our tool. So here in front of you, you're seeing the 5 different stages that we go through. I want to highlight for you the things relevant to what we are talking about right now. So in particular, the discovery piece is something that Christian and I are heavily involved with. And what the discovery piece means to us is, well, one, it's forever happening for the entirety of our relationship because things are always evolving inside the healthcare system and hospital. But our initial discovery really revolves around our team at Leantas understanding what is the operational reality at your hospital, at your healthcare system. Kind of going back to the point of really establishing current state and what it is you're trying to aim towards. What is that desired outcome that you want to go through? And then we really figure out what is the gap? Where can we come in? And we like to highlight sort of or communicate how our solution is specifically going to help the organization with their pain points that we have discovered on our journey. And that really, really helps to build the trust and understanding between our customers and us. And it also provides us with the information we need to take back to our team on how we configure the application to the customer and their system. Every hospital, every healthcare system often have similar problems, but slightly different flavors and different kind of structures and positions and roles. And so we make it a point to really understand what is the fabric of their system. Now, the next 2 phases I want to also highlight are the stage part and the launch part. The staging part of our implementation really gets into testing and validation of data. So we set up these live feeds of our tool with the EMR in the back end. So in real time, the tool's constantly being updated with whatever is going on in the EMR, because that is kind of your central source of truth and where everyone documents everything. Now, we spend a lot of time during this period with a core group of users, usually the initial champions who agreed during the process to really embed this tool, and they are leaders in their healthcare system. They help us, honestly, to validate the data, to make sure, look, how are we defining certain terms? Is that how you all define some of your census data, and et cetera? Because sometimes there needs to be modifications. Sometimes there needs to be some agreed upon understanding of how you actually define XYZ. And that really helps to build the trust, to really work on validating those numbers before releasing it to the larger audience, because it's already been vetted by the internal champions. The last part of our implementation, of course, is launch. And this is exactly what you know it to be. But this is the larger go live. This is the huge hurrah that happens after we spend, days and weeks training different staff members on the solution, and so that they have a really good understanding of how to navigate the tool. And then we just turn it on for them, give them access, and they're ready to go. They can hit the ground running. And as a company, we are there to provide support constantly. whether it's through Zoom meetings, whether it's on-site support that we often do during the go lives and additional recurrent visits that we do to the healthcare system. And we also roll out the launch process in addition to stage in a tiered fashion. So let me actually give it back to you, Christian, and you can explain some of that discovery piece a little bit more in depth.
Yeah. On the discovery standpoint, we use it as a first face-to-face understanding of the lay of the land of how our customers' operations work. We understand that when it comes to inpatient bed movement and flow, there are a lot of moving parts, and it encompasses many different departments, people, and lots of different moving parts that work together in order for patients to move from one unit to another, or the admissions process and the discharge process as well. We use a sample of questions to understand what your operations are, how your department runs, and how it all works together in the bigger picture of things. So we identify the team members that currently work on flow in order to gain that understanding of the current state and also desired outcomes as well. So we'll meet with different types of groups, whether it's EVS, case management, social work, the charge nurses and unit managers. This may all differ depending on the health system that we're working with, but we really do get a base understanding as well as a lay of the land to see how flow is being worked on in your hospital. And this has also, in the pandemic, expanded to on-site visits, which we find very valuable. Understanding those nuances that really can't be shared virtually, and understanding workflows and being able to see things in person really help us to get an understanding of the operations of a hospital. And so that's our discovery phase, where we really just, it is a big understanding of discovery and how things work within the hospital.
Excellent. Moving a little bit also more depth with the actual staging part of our implementation. This is what we call as user acceptance testing. And this is that whole thing that I mentioned where we really sit down with certain key champions and core initial users of the tool with our customer. And they help us validate the numeric outputs, all the data that we are getting from their EMR and coming into the tool. And it is so important that we go through this period quite thoroughly with those select few stakeholders, because it allows them to, one, not only get comfortable with the tool, but two, to really have a hand in the process of making sure that we really have these numbers right and that they really do reflect what is occurring within their system and in their hospital, which again continues to help build trust. So here you're seeing an example of literally some of the questions we walk certain folks through as we go through this part of our implementation. All right, Christian, I'm going to hand it back over to you regarding the launch aspect. Let me go here. There you go.
For launch, we actually take a tiered approach. So we want to identify the key super users of our tool. And we understand that every hospital is different. So we actually customize those tiers for every hospital system, since the operations are so different between one hospital to the next. So we identify the key super users, and we provide at the elbow support, not just at launch, but also in the stage and discovery stages of our launch. So we provide the support and we roll out. So we focus on the key processes in an organization where the solution can be leveraged. And we support integrating solutions into key processes. And we help out with things such as mock huddle runs, really being on site and making sure that our tool is being used correctly, and really responding to the feedback that we get from the floors as well. And it doesn't just stop there. We have follow-up visits, and we continually have feedback from our customers to see where is the tool working best and where can we help a little bit more, help and support in areas where the tool might be useful, but isn't currently used right now.
Awesome. Thanks, Christian. Yeah, I wanted to also additionally just highlight, we really want to make sure, I mean, you're just seeing an example here. We like to, again, sit down with our customer and make sure that this is configured to the specified roles one has with regards to flow in their system. So they will potentially be different. They might be different staff, different administrative folks. And those role definitions are something we spend a lot of time initially in discovery, which then helps us really build out the appropriate tiered launch that you see here. And we take this quite seriously so that we can smartly and strategically bring in folks at the right cadence, such that when they do join and they learn the tool, it is of highest value for them. And they see and they understand how it fits in potentially into their workflows, or at least they understand the efforts of what we are doing. Okay, let's move on to a little bit about kind of the hardest part, honestly, when it comes to implementation and to any of these efforts, as I mentioned before. And that is, of course, change management. There is no easy way to do this, but it is something that is absolutely very, very important for us as a team, especially Christian and I, to delve into detail about what we have come to learn through our discovery and through the data that our teams have gone through with both data and engineering, and then learning about the processes we did, and then kind of putting our perspective of what or where we see potential areas of change management that will need to be addressed. What you are seeing up here as an example is a change management structure. We have used the Prosky ADKAR framework, if you will. There's many other frameworks one can use. We kind of adjust based on who we are working with and what makes sense. At the end of the day, we just want something to use so that it can guide how should we go about making sure that certain areas are addressed as we try to implement and hardwire the tool into existing workflows. Now, as a company and at IQ for inpatient beds, what we will do is what you see here in the following. This is just one piece because we are kind of a third party coming into your hospital or system. So we will kind of showcase what is the perspective based on what we know, but we know that this is only one piece of the puzzle. The majority of change management is going to come from the insights we gather and the input and the participation of the customer themselves. What we love to do is engage in a very active discussion regarding those change management areas within their processes. And we help support those different areas in a variety of ways and kind of how the tool can help support them. And we also help kind of understand and establish and build trust, but with our customers' partnership, because this cannot be done alone by us. It has to be a partnership between the customer and us as we kind of navigate all these different areas in where our capacity software will start to be used. And there are different types of data that folks are going to be exposed to that they're not used to seeing. And new things are always hard to adapt to. We respect that and we take that very seriously. So actually, Christian, it occurred to me, so you are actively working with some of our customers right now regarding this process. Any points to highlight there as you've been going through this?
Yeah, I think it's really identifying the right people that will help push these change management processes and helping using their leverage to make change possible. And I think that's where we found the most success.
That makes sense. Yeah, so this is just the beginning. We actually spend most of our time constantly engaging with our customers of understanding a couple of things, especially when it comes to change management, was what has been the history with regards to some of these processes that we delve into with more detail. What has worked? What has not worked? Who are the key people in your institution that have led these efforts? Who else do we need to bring to the table so that they understand what we're trying to do here, and that we are here actually to help support and essentially just elevate the efforts that have already happened, so we're not reinventing any processes. So that work takes a lot of time, and it's through a lot of different ways in which we do this. So specifically, Christian and I will be meeting with our customers at least weekly, if not more, during the week, depending on what is necessary to establish all of this information and this discovery piece that you saw earlier. And we spend a lot of time offline also preparing, again, our perspective on these different aspects. So, so that kind of brings it to a close. I did want to take a second and go back to one slide that I wanted to, since we have a little bit of time, I did want to highlight with regards to the implementation stages. And then, Christian, if you have additional points, you can jump in. But two stages that I did not actually highlight was the initial stage, that is the data piece. That piece is actually extremely important. It doesn't necessarily involve people like myself or Christian who are more operations kind of customer-faced frontliner focused. But this stage heavily involves the hospital and the customer's data and IT teams, and our data and IT teams. And at the end of the day, we need to make sure we have the data from the customer, and we need to make sure it is the right data, it is defined appropriately, and it matches, like I said, the operational reality of the hospital. This can take some time because, you know, these are not kind of actions that the IT team is necessarily used to performing on the daily. This is a little bit different from that. And we appreciate that it is a little bit of a different type of ask, but it is one of the most important key pieces with regards to setting our implementation off on the right foot. Christian, anything to add from what you have experienced so far with our most recent implementation efforts?
Yeah, I think with data, it's important that we're on the same page with our customers. A lot of work gets done, and really data is such an important point that really shouldn't go unnoticed in the pivotal kind of moments in building up to stage and launch, and making sure that we give our customers the tools that they need data-wise, and also being clear on what the expectations are early on from the data side are very important in building the success for the engineers to create a customer-centric application.
Yes, exactly. And honestly, this is a great first step, because there's always hurdles and things that come up with maybe we don't understand the right thing, or the right thing is not being asked for. And these are kind of really good exercises in partnership with the customer and us to figure out the answer, because it is always worked out. It just takes the right people and some time, and things get sorted out. But it is such a fundamental aspect of our implementation. The other thing I wanted to add with regards to the discovery piece, just to give it a little bit more detail with what we like to do, we also like to ask for their existing kind of hospital policies, their structures, all the different roles, and all the current active kind of process improvement efforts that are going on. Usually a lot of hospitals will have process excellence and other types of work going on. And like I said, our main ambition is not to come in and just halt everything and say everyone must use our tool. Absolutely not. The only way our tool is successful is that we really respect what is the current active work going on in the hospital at this moment in time, what has been the prior work in the past, so we know a little bit, like I mentioned, what has worked, what has not. And honestly, this type of information has been extremely helpful for us, because it helps us to, again, not to use a tech term, but really honestly configure and understand how we could potentially see our tool being embedded into existing workflows. Because we, like I said, us coming in is new enough as it is, but we do not want to completely thwart existing efforts going on at this point in time. What we'd like to do is very nicely and effectively introduce aspects of this tool, but within what the structure that you have already. And what we have noticed time and time again with the success folks start to see, because they understand, oh, wait, when you actually integrate predictive analytics in your day to day, and you're starting to not just react to what's going on right now, but you're actually looking into the future constantly, and the models are accurately showing you what's going to happen in the future, the whole game plan changes. The philosophy of how you tackle issues changes. You're no longer spending all your time establishing current state, because we already have that in our tool. So anyways, we go through kind of a whole barrage of reviewing documents, processes, structures, roles, and all of those things. And Christian and I will spend a lot of time interviewing folks. And initially, we even like to go on site, which you notice it says a 2-day on site. Sometimes it's often even longer. We like to go in pretty early and just walk the floors, as in lean speak, go to the Gemba and really understand how folks are kind of, what is the geographical footprint of their work and their operational workflows. Now, moving on to another part of our implementation that I did not highlight before, but it is, since we have a little time, let me just go into a little bit. The build stage is extremely, extremely core also to our implementation. This is the part where our data analysts, our data engineers, our data scientists spend a lot of time literally building the tool for our customer in a variety of ways. The data scientists, they are kind of, the work that they do is being mentioned in that first bullet point. They spend a lot of time after kind of these live feeds and the data starts coming in, they spend time creating these predictive models within our tool based on a set of variables that they can pick up on through those data feeds. And then they model for each unit within a hospital, and then even at the patient level and at a higher level, at the house level or hospital level, what we think the prediction will be as far as admissions, discharges, bed balances, you name it. But we like to cover all levels. So starting with the house, then at the unit, then at the patient level also. And then we have this whole aspect where, again, folks like Christian and I spend a lot of time just making sure that the configuration within the tool really matches the structure of the healthcare system, right down to the nitty-gritty details of what are the units named, which units do we actually define in scope for adult inpatient or whatever patient population we are focusing on, the bed counts, the hallway beds, the surge beds, etc., the groupings, what are the views, when you do your bed meetings and huddles, which services do you review, all those types of details. We spend a lot of time going through all of that. Actually, Christian, any additional points or observations? Because like I said, you're going through this currently right now with one of our customers too.
Yeah, I think really building the discovery portion plays such a pivotal impact on how the building of the product goes. And so the reason why we delve so deep into discovery is to make it consumer centric. So for our customers to be, they paid good money for our product, and we want them to have a product that not only works for them, but it's easy to use, and it is something that they don't have to really go through lots of time and understanding. It should be very easy to digest, and they should be able to work off of that. And I think the big thing is, instead of working reactively, it's looking proactively at things to work on within flow, within our IQ inpatient tool. That's really important. And the discovery all really builds into the building of the process and also the data. And so there's a lot of moving parts within our data and discovery portions that get baked into the build of our application as well.
One other thing you'll notice on the slide, it mentions that the discovery and implementation tasks, a lot of these things, even though it's showing as a linear thing here, occur actually simultaneously. And that's important to note, because even before we start getting the data, Christian and I will start getting on calls, on on-site visits even, to start doing our discovery piece with customers. So that is the nice part. A lot of these processes can work in tandem. And that helps with as far as implementation time goes to get the tool into the customer's hands. The other thing that I wanted to also highlight, and then we can go into questions a little bit, is the discovery piece is something that we do, like I said, for the entirety of our relationship. I often joke around. It's kind of a death till death do us part sort of scenario with our customers, because we are there for the long run. And I know personally, being on the frontliner end and being on the leadership level in hospitals, hospitals are always trying to understand what can they do better, what do they need to change, what do they need to reassess, etc. We are well aware of that, and the beauty of us being outside of the system and being a technology company is we are huge on innovation and fast turnaround. And we want to constantly have our finger on the pulse of how things are changing, both with our customers and what the industry can offer as far as technology goes to help support such processes. So with a lot of our existing customers, Christian and I will meet with them ongoing post-implementation. We still meet with them on a weekly basis, sometimes more, depending, as they implement or put in newer efforts. As when it comes to capacity, it's actually one of our newer, more infant fields. Although those of us in healthcare, we are quite well aware of flow issues for years on end, but it's only recently been getting a little bit more structured, and people are starting to talk about, okay, what is a best practice? What should we do when we're using extra beds, when ED is boarding, when et cetera? And so we are constantly involved and touching base with our customers. And we're going through a laundry list of questions and then figuring out, okay, what can we build in the tool also that supports them in with these newer processes that weren't present or hadn't been identified initially. So we're constantly understanding this aspect of discovery and focusing on that innovation part, but most importantly, trying to understand how can we truly support them with the tool that we have in hand, with the technology we have, because that is all we care about. All right, I'm going to end there, and I think we can move on to questions at this point. Okay.
Thank you so much, Dr. Sanyal Day and Christian. Can you all hear me? Am I?
Yes.
Okay, great. I always have to check. That was terrific. Thank you so much. We do have several questions. I just want to make an editorial comment, since I'm an editor and that's what we do. And that is, I so appreciate how you all really understand and fold into your operations all the change management aspects of this. And of course, it's natural that you would. You're lean TOS, you're about change management. But these kinds of processes are very, very complex, and you've both articulated that so well. So I just wanted to say, I think it's admirable that you really have thought through how much of a role change management plays in all this.
I appreciate that. Thanks.
Certainly. So we do have a few questions from our audience. The first one is, and this is a good one, with staff burnout on the rise, how do you get people excited about implementing new technology, especially early on in the process? And I certainly, our reporting certainly is confirming high levels of burnout in healthcare. And I know that you're both aware of it, and I'm sure you witness it, Dr. Sanyal Day, day to day. How do you get people enthusiastic about these kinds of change-making initiatives in the context of burnout and exhaustion in healthcare?
Mark, I think I can start off taking that one. I think right now, with the current state of healthcare, I think we've come to a point where we understand that our current processes are not necessarily working for everyone. One of the things that we really need to implement is technology to help us in our current operations and our processes. And I think people see that it's once they have in their hands a product that works and helps them to alleviate the stresses of every day, it really helps them to optimize their processes, makes things easier so our frontline healthcare workers can focus more on patient care and less on the small nuances of the the job descriptions that they're asked to do.
Yeah. Dr. Sanyal Day, do you want to add to that?
Just that I will say I personally experienced burnout. I've written about burnout, and even burnout from like doing process improvement, because honestly, a lot of our internal efforts for PI and healthcare systems, the efforts to make things better usually land on the frontliners, unfortunately, at the end of the day. And it's a work harder, work faster scenario, or the other way around, which is, as healthcare workers, we're excellent at workarounds. We will figure it out to make things happen, but it is extremely reactive. As Christian had mentioned before, it is so reactive, and that constant grind just takes burnout to the next level. And the pandemic showed that at its height. But one thing that Christian said that I really like and is so true is there has to also be a understanding by the customer that, guys, what we are doing right now, it is actually not working. This is not sustainable. We must change. This is not it would be good to do. No, it is necessary for that change. And that kind of sort of acceptance of the truth and messaging that out and reflecting on that is so necessary when we work with our customers, and acknowledging that, you know what, I'm sure we're doing some things great, but the reality is there's other things that we can do much better, and we need help. We cannot do it alone. And that's where the magic happens, because we get to come in from Leantas and partner with these folks, but the trust is so necessary. And once that trust is sorted out, internally, staff members and leaders, when they align and they acknowledge, they are honestly kind of the main campaigners for the technology, and they help us guide how do we, in the least painful manner, embed and support the technology into existing workflows to help with what you just asked. So
yeah, I think that makes a lot of sense, Doctor. And just coincidentally, yesterday I interviewed the Chief Well-Being Officer of a major health system. And there are more people apparently with that title, which isn't that great?
Isn't that awesome? It's so good.
I think it's really great to have a Chief Well-Being Officer. And I'm just going to reference that because what you said plays exactly into what she said. You have to find every change that you make, you have to weigh how it will impact clinicians and staff. And I like what you said. You have to show them and demonstrate that you're going to make things better, and it's necessary to change, not because otherwise everything feels like another add-on to what they're already doing. And I'm sure you experience that in your own practice, right?
Oh yeah.
Yeah.
Oh, yes.
Yeah. So the next question we have follows naturally on the first question, which is, what types of communication tools do you use to ensure that everyone's aware of the progress that's taking place during implementation and as these initiatives move forward? Either of you who would like to start?
Yeah, Mark, I can start with that. The thing with communication with Leantas and our customers is what Dr. Sanyal Day mentioned, is that we're in constant communication with our both our end users and also the administration of the hospital, understanding that our tool is not just something that we leave for people to use and they're kind of left to just kind of figure it out on their own. We are maintaining constant communication through weekly check-ins, as well as emailing and kind of email blasts to the end users through organizational channels. And I think we found that to be helpful of the partnership, that aspect that we talk about. I think if an external user comes into a health system and just starts telling people what to do, it's not received in the best way. So I think we use our internal contacts to really push out the things that we want to say and leverage their understanding of how things get communicated best within their hospital system.
Yeah. Dr. Sanyal Day, do you want to add to that?
Yeah, sure. As Christian was saying, it is kind of a variety of different things we use because we understand we can't meet in person with everyone exactly when we want to, because, these are frontliner staff, these are leaders, these are flow folks running around the hospital, actually having to do the work. So, so we kind of make sure that every possible medium is available to these folks, whether it is through, Zoom meetings or calls, email content, recorded videos. Christian and I, along with our outbound team, will go on site at a certain cadence and according to people's schedules and meet with folks. Christian's actually literally in progress of coordinating a site visit where he'll be there on the weekend, like at 6 a.m. so that he can meet with the night shift, these house supervisors that will want to be one of our core users, so he can really make sure he hears and understands and is able to communicate how the tool works. So we really like to use a whole spectrum of different types of tools, depending on the role of the user, their schedule, and what works for them. Because as you know, everyone kind of learns in different ways too. Some people love looking at videos, other people need to hear it and talk in person, and other people like to read things, and tip sheets will not work for all. Let's just say that. That is not the way we tackle it. We do it in a variety of ways.
Yeah, exactly. So here's another question. What do you both feel is the biggest challenge in change management? Or maybe you can take two biggest challenges, but what are the hardest things to achieve?
I think to start off, one of the hardest things to achieve in the beginning, outside of after the sale and people signing on the dotted line, is to truly make sure there has been alignment from both top down and bottom up with regards to acknowledging, look, we need to change our methods in which we manage capacity, and we need to evolve with the tools that are now available, with the analytics that are now available. And we believe that this specific tool that we have chosen to work with, we really see why this would work and why we should try to figure out how to embed this. Just that getting that alignment from all the different layers in a healthcare system is no small feat. Because as you know, when it comes to the initial interactions with healthcare systems and customers, it's always, your C-suite and it is your leaders. But for me, I actually find the frontliners, like the folks who are literally the unit managers, the charge nurses, the physicians leading, they need to be on board too, because they are the ones who are actually going to be using the tool in certain ways. And so making sure all of those voices are not only heard, but they are aligned internally within the system when customers sign on to work with us is a huge both challenge and a necessity to have in line when we enter into our relationships with folks. So that's one thing to come off mind. Christian, anything that comes to you? Otherwise, I'll go to a second point that comes to mind.
Yeah, no, I think just what you said, top down, bottom up, really is that buy-in from our end users. And I think that's why we really implement for our launch is that tiered launch to see who are really the super users and how can we really use them to buy into our product and then kind of launch to a larger audience from then. Because we want to keep that stickiness for those users who will be using our tool to provide predictive analytics and really work proactively in solving flow within the hospital.
That's terrific. And we have one more question here. Do you conduct regular pulse checks during the implementation to ensure that everyone is still on board with the changes? And if yes, how do you do this? Do you do it through surveys, one-on-one conversations, and how often? Who would like to? Whoop.
I can take that, and then Christian, feel free to add on. So yes, we do constant pulse checks. Like I said, it's kind of like we get into these relationships where it's like a marriage or like having children. You will always be in contact, or you will be hearing from us. We shy away from surveys just because I've been and continue to be on the inside the system where we are surveyed to death, quite frankly. The moment I see a survey, I'm like, oh, not another one. So I try to use some of that knowledge that I know that of those folks on the inside. That is not generally a way we go about things. We like to do focus group sessions, emails, certain conversations within teams, etc., and constant check-in points at a certain cadence depending on the user role and how much they will be in the tool. We will be constantly checking with folks. And then we have ways internally also of assessing in great detail who is using our tool. So we appropriately are constantly understanding, okay, this person went to this part of the page and they clicked 20 times. Like, we get that granular on the tech side of things. And we use that intel to then guide, okay, these are the folks we need to chat with. Why is their usage falling off? Or why are they really interested in this particular aspect of the tool that we didn't even know? So we really dissect the user's touch points within the tool with the technology we have even in LeanTus, and use that also to guide a little bit more specified strategic focus on how we do our pulse checks outside of the general kind of, cadence checks that we do with folks.
Okay, great. Kristen, would you like to add anything to that?
Yeah, I think also what Pallavi mentioned is we check what part of the tool that our customers are using. If they're using our tool in a certain way, we want to know how they're using it and how it's helping them. And we understand that not all the operations are going to be the same across different hospitals, but if we're seeing a trend of a unit manager going into a specific view to do their work, then we want to know why are they doing that, and can we share that information across our customers so that everyone is more successful using our tool.
Great.
I think it's all those pulse checks with that, but also with our on-site visits and talking to people, getting feedback on the floors. What do you like about our product? What are the things that you don't use and don't see value out of? So really constantly checking and when we're talking about the marriage and partnership of sorts is always really keeping a pulse on our current customers, and also in our implementations as well.
Okay, terrific. I have one question to ask, and that is, what does the next few years look like for you guys? How will what you offer evolve, if in any way? And what does the landscape look like for these kinds of tools?
Yeah, I can take that. So the core of our company is based off our ability to do predictive analytics or machine learning, using machine learning models to really forecast and predict your future. And that has been the core kind of tenet, to use that mechanism to help empower folks in healthcare so that they are no longer reactive, but proactive. So that has been kind of the core central way in which we have designed our tools to revolve around. That's the core construct. Now, as we are moving into these upcoming years and things that are coming to light as far as newer technologies to be used, we are definitely constantly having kind of ongoing exploration and innovation with regards to that machine learning modeling that our data scientists are really focusing on. I think the next layer that they are focusing on which is an aspect of machine learning, is natural language processing. Yeah. And that is really taking it to the next level, because a lot of the tools, and even within the EMRs, the existing processes really require the front end user or the staff member or the provider to literally add information so that certain processes can happen. You have to add it in the specific field in this part of the EMR. You have to text, page, secure check, whatever it is. NLP is going to eliminate that effort that is required by staff members to constantly document in 20 different places, or to communicate in all these other places what is going on with the patient, with the process, with et cetera. Because NLP automates kind of extracting anything that signals whatever you're looking into, which in our case, it's going to be flow or discharge processes. We'll extract existing things that you have to do already, whether the clinician is writing a note, whether the nurse is filling out a flow chart, whether the labs and the orders and the medications are coming through in the EMR. We have a taxonomy built by specialists such as myself, other physicians and nurses, who have literally built out taxonomies for different processes that help scrape the data for terms that signal, oh, you know what? This patient has endocarditis, and the cardiologist said they still need a TEE to do this. And actually, when we know they say TEE, they mean that this specific procedure is going to take this long and this antibiotic is required, et cetera, et cetera. And then we'll surface it right away without staff having to contact the medical team in a variety of ways, as you know, right? Paging, calling, texting, all of those things, waiting for rounding, which is a whole other realm, because those rounds have to be of high value and have to be perfected in the information that is shared. And it needs to be valued by all the participants so that they come and they engage in that conversation. Otherwise, those rounds are somewhat pointless. So this type of technology will eliminate that constant need to chase after information, that then the actions become very reactive versus proactive. So it will help save time tremendously for hospitals and healthcare systems. And I think this is kind of that new wave. People are already delving into this in the clinical decision-making world. We are using, as our company, we focus on operations, clinical operations. We are leveraging that technology for operations and flow optimization. So that's kind of what we're looking into and actively testing and building right now.
Okay. Terrific. Kristen, is there anything that you'd like to add to that?
Yeah, I think really it's our basis of innovation. We're always looking at what are our customers looking for and how can we help them get to that end goal, and really optimizing our product, so, and also changing our product when needed for our customers. So always looking ahead, but also making sure that they have the right tools to succeed today as well.
Yeah, that's absolutely. That's a great strategy. That is all the time we have for today and all the questions we have. I want to thank you both so much for a terrific presentation and a great discussion. So Dr. Pallavi Sanyal-Day and Kristen Jun, thank you so much. This has been terrific. We have about 1 minute if there's anything else that you want to add in conclusion.
Thank you, Mark.
Okay.
Thank you so much, Mark. It's been a pleasure.
Absolutely. Here too. Thank you so much. So this concludes today's presentation and webinar. I want to thank our presenters and also all the folks at LeanTaaS for making today's program possible. And finally, I want to thank everyone in our audience for joining us. We hope you'll join us in the future for another healthcare innovation webinar. This concludes today's presentation. Have a great day, everyone. Thank you.